PCOS symptoms you might be ignoring, and how to treat them. Polycystic Ovary Syndrome, commonly known as PCOS, is a hormonal disorder that affects roughly 1 in 10 women of reproductive age. Despite its prevalence, PCOS remains underdiagnosed, largely because its symptoms vary widely and are often misunderstood. Many individuals may live with its effects without realizing what they're experiencing is part of a larger condition. In this video, we aim to explore the subtle and often ignored signs of PCOS and provide actionable, evidence-based strategies to treat and manage them effectively. If you've ever wondered whether symptoms you're experiencing might be related to PCOS or are simply curious about how it manifests and how to address it, stick around. Understanding this condition could be your first step toward improving your health and well-being. PCOS is a hormonal condition that disrupts the normal functioning of the ovaries. This occurs due to an imbalance in the body's hormones, particularly an excess of androgens, male hormones that women naturally produce in small amounts, and insulin resistance. This imbalance affects how the ovaries release eggs, often leading to irregular or missed periods. Because PCOS symptoms vary significantly between individuals, they are often overlooked or misattributed to lifestyle factors, stress, or unrelated conditions. Recognizing the full range of symptoms is critical to getting an accurate diagnosis and receiving appropriate care. When most people think of PCOS, a few hallmark symptoms come to mind. These include irregular or missed periods, one of the most common signs, as irregular ovulation disrupts the frequency and length of menstrual cycles. Excess hair growth, hirsutism, a result of excess androgens, leading to unwanted facial or body hair in areas like the upper lip, chin, or abdomen. These two symptoms are widely associated with PCOS, but they are only part of the picture. Beyond the widely acknowledged symptoms, many PCOS signs are more subtle or likely to be dismissed as unrelated issues. Keep an eye out for these overlooked indicators. Unexplained weight fluctuations. PCOS often leads to weight gain or difficulty losing weight, even with regular exercise and a balanced diet. This is due to insulin resistance, which alters how the body processes sugar and fat. 2. Persistent acne in adulthood. Hormonal imbalances can trigger severe or recurring acne, especially along the jawline or chin. This type of acne is often resistant to traditional treatments. 3. Thinning hair or scalp hair loss. While excess hair growth occurs in some areas, women with PCOS often experience thinning hair or even bald patches on their scalp due to high androgen levels. 4. Chronic fatigue. If you frequently feel tired despite getting enough sleep and leading a reasonably active lifestyle, it could signal an underlying issue like insulin resistance or metabolic imbalance linked to PCOS. 5. Mood swings, depression, or anxiety. PCOS often goes hand in hand with mental health challenges. Hormonal fluctuations may increase feelings of irritability or lead to more significant conditions like depression and anxiety. 6. Difficulty losing weight despite effort. Insulin resistance makes it harder for the body to shed weight. This can cause frustration for those following strict health routines without seeing results. If left unchecked, PCOS symptoms can lead to serious long-term health complications. These include type 2 diabetes, primarily linked to insulin resistance, heart disease. Elevated androgen and insulin levels increase cardiovascular risks. Infertility. Disrupted ovulation makes conception more challenging. Metabolic syndrome, a combination of hypertension, high blood sugar, and excess body fat, all connected to PCOS. Paying attention to lesser-known symptoms is essential. Early identification and treatment can help mitigate these risks and improve overall quality of life. The good news is that while there is no cure for PCOS, it is highly manageable. Treatment focuses on addressing the root cause of hormonal imbalance, alleviating symptoms, and reducing associated health risks. Here, we'll break treatment into lifestyle adjustments, medical interventions, and holistic approaches. Adopting a healthy lifestyle is often the first and most effective step toward managing PCOS. A balanced diet plays a significant role in managing insulin resistance and stabilizing hormones. Consider these dietary tips. Eat whole, nutrient-dense foods. Incorporate whole grains, lean proteins, healthy fats, and an abundance of vegetables. Focus on low glycemic foods. These help regulate blood sugar and insulin levels. For example, swap processed bread or pasta for complex carbs like quinoa or sweet potatoes. Limit refined sugars and processed carbs. These can contribute to insulin resistance and worsen symptoms. Instead, opt for natural sugars in fruits or honey, but in moderation. Physical activity not only helps with weight management, but also improves insulin sensitivity. Strength training helps build muscle mass and reduces insulin resistance. Cardio workouts, activities such as walking, running, or cycling, improve heart health and support weight loss. Mindful movements, exercises like yoga or Pilates reduce stress and balance cortisol, a hormone that can exacerbate PCOS symptoms. Stress has a significant impact on hormone regulation. Chronic stress increases cortisol, which can elevate insulin levels and worsen symptoms. Practice mindfulness techniques, such as meditation or deep breathing. Make time for relaxing activities or hobbies you enjoy. Ensure you're getting quality sleep. Poor sleep can disrupt hormones further. Specific supplements can address hormonal imbalances and improve symptoms. While supplement use should be discussed with a healthcare provider, here are a few widely studied options. Inositol, particularly myo-inositol and D-chiro-inositol. These compounds help improve insulin sensitivity and encourage regular ovulation. Omega-3 fatty acids, found in fish oil, these reduce inflammation and improve heart health. Vitamin D. Studies suggest many women with PCOS are vitamin D deficient. Proper supplementation can support weight management and hormonal balance. In some cases, lifestyle changes alone may not be enough, and medical interventions can be incredibly effective for managing symptoms. Birth control pills regulate menstrual cycles and lower androgen levels, reducing acne and excessive blood. Medications like metformin help the body use insulin more effectively, which not only prevents diabetes but may also support weight loss and ovulation. For those struggling with hirsutism or acne, anti-androgens reduce testosterone's effects on the body. The management of PCOS benefits greatly from a holistic approach. Combining lifestyle practices and medical solutions ensures long-term success. Additionally, ongoing research into newer therapies, such as ovarian drilling or anti-inflammatory treatments, holds promise for more targeted care in the future. When managing PCOS, self-awareness is your most powerful tool. Keeping track of your symptoms allows you to understand their triggers and monitor your response to treatments. Use health tracking apps or maintain a journal where you log symptoms, daily habits, and changes in your routine. This practice also helps communicate effectively with healthcare providers, ensuring that your care is tailored to your unique needs. It's crucial to break the silence surrounding PCOS. Many women feel isolated in their experiences, which can prevent them from seeking the help they need. Share this information with others who may benefit, whether that's with friends, family, or community groups. Managing PCOS isn't about dramatic overnight changes. It's about taking small, consistent steps. Whether improving your diet, incorporating new exercises, or seeking professional medical guidance, every choice you make brings you closer to better health. Remember, PCOS is manageable, and with the right approach, you can improve your symptoms and overall quality of life. Awareness is your first and most essential step toward action. By recognizing the symptoms you, or someone you love, might be overlooking, you can take control of your health journey. Don't let these signs go unnoticed. Your body is always communicating, and it's time to start listening. If you found this video helpful, don't forget to share it with others to spread awareness about PCOS. Together, we can empower more people to make informed health choices. Thank you for watching, and remember, you're not alone in this